Hello, my name is Sukdeep Bains and I'm one of the students of UMass Global. So, this is the program of DNPU 705. So today we're gonna discuss about the Health Proactive Communication Campaign. So this is the agenda for today. So like we're gonna be discussions about the communication campaign, who is the high risk population, and what are the complication or problem that is hypertension, and how the health care theory helps to control or manage the blood pressure, as well as what the methods of communications we're going to use to elaborate our study. So the communication campaign, we can say, are the broadly defined as the purposive attempts to then inform or influence the behavior in large audience within a specified time period using an organized set of communication activities and featuring an array of mediated message in the multiple channels generally to produce non-commercial benefits of the individuals and the society. So we can discuss about who are the highest populations for hypertension, because our the main study program is the hypertension, how this problem is leading to the great high risk disease conditions, and how we can control this blood pressure. So the groups which are high risk are, first of all, is the African American have the highest prevalence of the hypertension among racial and the ethnic groups. Not only are they most prone to the high blood pressure, but control rate are lower in African American as well. In this population, hypertension typically is more severe when the diagnosed, and therefore less likely to be well controlled by a standard treatment. So the another group is the older. The most likely we are develop high blood pressure. A main reason is because our blood pressure vessels are gradually lost elasticity as we age, which can cause the heart to pump blood harder. Furthermore, senior are more likely to have the stroke or the heart attack, which can both be at least a somewhat attribute to high blood pressure. So the another group is, for this one, is a pregnant woman are susceptible to the high blood pressure, as it can slowly elevate it during the second and third trimester of pregnancy. In the serious cases, the high blood pressures during pregnancy can lead to the conditions called preeclampsia, which can have the serious and sometimes the fatal complications for the both mother and baby. Moreover, research study tells the mothers diagnosed with the hypertension during pregnancy might be the more likely to have a high blood pressure later in their life. So it is very important during the pregnancy. Everybody keep eye on what changes comes to their in the body. So sometimes that conditions like hypertension, diabetes, thyroid kind of just leads to their whole life. So it's very important to just take care of your health. So next are the complications, like which how the hypertension is kind of just making the big issues. The first of all is the brain stroke. So the reduced blood supplies to the brain can lead to this rapid loss of brain function and stroke. It is a very bad condition. So when the people are almost kind of not able to do their daily activity even, so it is very kind of high risk problem. And then blood vessel damage because of the high blood pressure leading to cause of the atherosclerosis, the artery narrow process that can result in heart attack and stroke. Kidney failures, damaged blood vessels in the kidneys can't effectively filters your body, resulting in the dangerous accumulation of fluid and waste. Next one is vision loss. The hypertensive retinopathy, high blood pressures can damage blood vessels in the retina, resulting in the loss of vision. Next is heart attack. Hypertension causes the heart rate to pump against the high blood pressure, making it work harder than necessary. Over time, this causes the heart muscles to thicken, restricting blood flow, which can lead to a heart failure. Next is the bone loss. High blood pressures may increase the amount of calcium in your urine. that excessive eliminations of calcium may lead to loss of bone density. So we can say how the just little problem hypertension can leads to the major complication to leads to the major health diseases, which is it is kind of stuck your life. So it is very very important to control or lower your blood pressure. So I believe, the RM self-care theory is a very good theory and, kind of fitted to the hypertension, to control the hypertension. And so all the defined concept related to the nursing in the hypertension care form the basis of the nursing intervention, and the nurses make an assessment of the patient's self-care demand and the communicating with the patients to help uh, the patient changes lifestyle, that is to perform self-care. For that reason, the armed self-care deficit theory of the nursing is integrated as natural integrated in the proposed middle range theory. So I believe this theory is really good because this theory let us know how you can just like take care of yourself, which can be help you to relieve with the high risk complications, because this is the problem is not just starting from the majors, it is always starting from the base. If we control the base, if we can take care of yourself, so I think it's very easy to just control your high risk complications or high risk heart diseases. So so this is really effective theory, which is like it is important to just give the educations to community, so how they can easy way to just taking care of their health. So I believe the Facebook is the one of the method, which is kind of easy way to just like you can just connect with everyone, because this is the Facebook is not only just stuck with the one community or one place, so you can just like give your educations to anywhere anytime. And because most of the people are on the Facebook now these days, so I believe it's good, so teach them on there how the mobile app is effective, like the smart BP tracking app is effective, and what are the yoga poses or the yogas can help them to control their blood pressure, because our studies also elaborating how the yoga is effective for their controlling the blood pressure. So I think communication method is the Facebook is the very good methods to just convey your message towards the whole mass of community. So this is so these are the some references which I just like get it for my this presentation. I hope everyone like it, and just thank you very much